Welcome to Partners in Healthcare. My name is Gary Removich. I'm your host and the director of the Physician Assistant Program here at Wingate University. Today we're going to be talking to two of our newest faculty members. This is quite an exciting time for us as our program continues to expand, and now we have 60 students within our PA program. Our interest is not just in training our PA students here locally with didactic information and clinical practice, but actually getting them out into the community. Our students must expend over 2,000 hours in clinical experience during their clinical rotations. Also, we have a service learning component. Our program last year used 1,800 hours of community service through our students. It's a pleasure for me to welcome Rebecca Bochelle and Kay Hawkins.
Thank you. Thank you.
Thank you both for being here.
Absolutely.
And let's talk with you a little bit, Rebecca. You're our clinical coordinator. How did you come to Wingate?
Well, actually, I started with Wingate at the first year. I was invited to be an adjunct professor teaching clinical anatomy and pathophysiology. At the time, I was teaching at another university here in town and saw it as a great experience to work with physician assistant students. So I started that way, and then more recently this summer assumed the position of clinical coordinator.
Michael Whitehead was initially the clinical coordinator. What happened with his position?
Michael Whitehead went to become program director at Clarkson University in New York State. His new program will open up in 2012. And fortunately, I was able to, before he left for New York, I was able to work with him for nearly 3 months, transitioning into the position and having him sort of mentor me in the process of being a clinical coordinator. So it was quite helpful.
Very good. And Kay, how did you come to discover Wingate University?
Well, I've lived in the surrounding area for quite some time and practiced in this area as well. Had a good bit of input with the health department here in town, so knew a lot of the people that we are now, through Rebecca and Michael, working through in our preceptorships. And so Wingate was a part of my upbringing in this area. And I'm very involved in mission work and love the concept of service learning and service giving back. And when I heard that this PA program, which is one of the few in the country, if not one of the only ones in the country, that has a service learning program, I was ecstatic to be able to become a part of it. So I worked with the service learning aspect last year, and then this summer taught the women's health issues, and now this year have started, and it's the first time as full-time faculty.
Very good. And tell us a little bit about your background.
Well, I started in respiratory therapy, which is a paramedical field, and decided to go back to school after I had worked in that for 4 years. So I continued to work and went back to school at UNC Charlotte.
Very good.
Still fairly local.
Yes.
And completed my bachelor's degree there and went to medical school at Bowman Gray, and completed my medical school degree there and went to California to do residency in obstetrics gynecology and had to come back home.
Very good, very good. And we're thankful you did.
So that's
thank you,
thank you.
Rebecca, tell us a little bit about your background.
Well, I'm also from I am from North Carolina. Grew up in Winston-Salem, and my undergraduate study was at UNC Chapel Hill. I worked in an immunology lab at Wake Forest for a couple of years, and then decided that I would rather be working with human beings instead of mice and guinea pigs and tissue culture. So I applied to PA school and attended at Wake Forest. After PA school, I went to Texas and worked at the University of Texas in San Antonio, where I worked in gastroenterology. And then with a family moved to Augusta, Georgia, and worked at the Medical College of Georgia in pediatric hematology oncology. And I always tell my students one of the most fantastic things about being a physician assistant is that you are able to make changes like that. Very different practices, gastroenterology versus a pediatric practice, but I was able, with my sort of generalized training, to be able to make that transition. And then decided that I wanted to teach and moved into the teaching world after those two experiences.
Very good. And both of you are intimately involved with outside areas of interest as far as our students doing clinical rotations or doing service learning. What are some of the requirements that our students have for clinical experience?
After their didactic year, our students enter into the clinical phase of their training where they're required to go on 10 rotations, each lasting 5 weeks. And so this gives them exposure to all different areas of medicine. They rotate in ambulatory care, sites, women's health, pediatrics, general surgery, behavioral health sites, and they are able to learn from all these experiences and really see where they may have an area of interest. They also will have 2 elective choices that they can make at the end of their required rotations, where they can choose perhaps to go into a specialty area like dermatology or cardiology or orthopedic surgery. So all told, they spend 10 5-week rotations being very active. The important part of this phase of their training is that it gives them an opportunity to get some clinical experience and be able to put together what they've learned in their didactic year with some hands-on experience. So it's quite an exciting time. We've got new students right now out on their first rotations, and it's quite an exciting time for them and frankly for us as faculty to see them getting to do new things and learning so much.
What has been the feedback from preceptors that are watching our students and encouraging them in their learning process?
Well, we do solicit their feedback quite regularly, and to this day, and, you know, we're a young program, but we've gotten excellent feedback, and we're looking forward to graduating our first class in December.
Yes.
And this class, as they've progressed through their year of clinical experiences, they've done very well, and many of them already are looking for jobs and having great experience finding jobs actually already. So we've been getting very nice feedback from our preceptors, and we're thankful for that.
Very good. Are there any testing involved with our students after they go through a rotation?
Yes, at the end of every clinical rotation, we do have them complete an end of rotation exam, which we put together. We give them a syllabus with learning objectives that lets them know how to prepare for that exam. But yes, they will be tested. And the questions that we have on that exam are similar to the board questions that they will have when they have to pass their board. So we feel like it's not only a way for us to measure their learning, but help them prepare for their board exam, which they'll have to take in the future when they graduate.
Very good. Very good. I think many people can understand clinical rotations for PA students, but the service learning component, sometimes that might seem as if that really is not as important. Our program tends to put a lot of emphasis on service learning. What is your perspective as far as the need for service learning?
I think that service learning is so unique in that it is not just volunteerism, where the students go and spend some time somewhere. It isn't just them learning, it is an interrelationship of the two, so that the students are learning, the students are being teachers, the sites are learning, and the sites are being teachers. And I think that's a wonderful thing, because we are all blessed with an ability to be able to give back. Whatever talents we have, we should share those with the communities within which we are finding ourselves. And for the students during their first didactic year, when they're really wanting to get those white coats on and go out in the clinics, it is a fun interim to allow them to understand, no, you're not ready to give that physical care yet, but that doesn't mean you can't take the gifts that you already have and share them with your community, in the hopes that as they continue to further that base of knowledge, they will again go out into their community and be involved in service learning always.
Sure.
Sometimes they'll be the teacher and sometimes they'll be the learner, and most of the time we're all a little bit of both. So service learning is an area where the community outreach sites, such as free clinics, such as prescription pharmacy health quest type ideas, such as youth homes where troubled youth are helped, crisis pregnancy centers, the areas that need an input from people to help out. It then becomes not just a volunteer site, but a learning process as well.
Very good. The students very often are overwhelmed when they first start the PA program. 18 to 20 semester hours of work, and it's very intense. And the material they're learning is quite complicated. I'm sure you have some complaints that they don't want to do this, or at least they're hesitant to give up 8 hours a month in service learning.
They are sometimes.
What happens with them when they go through this process?
They come in and they think, oh, so much to learn, and now you want me to go volunteer my time somewhere?
Right.
And no, I don't want you to volunteer your time. I want you to be involved in service learning. And every one of them has come back with a positive outlook, because we bless ourselves by blessing others.
Yes.
And through this, it gives them a strength as they go through the rest of the year. It's a wonderful experience that they've had. I have not had, at the beginning, yes, but at the end, I've not had a single complaint, and every one of the students has been very positive about what they got back, how they were gifted, and how they were served in this service learning.
Very good. In fact, I've heard that many of our students, they continue with
Yes.
volunteering or service learning even after they're not required to do so.
Absolutely.
Which is
Absolutely. It is amazing. It speaks volumes.
Right.
We actually have, in the second year, our students can volunteer in a free clinic that Dr. Roy Blank, our medical director, is in
Yes.
charge of. And I keep up with those volunteers, and we have to wait list them. There's such an interest in volunteering in that clinic. So I think the experience they have with service learning in the first year only carries over.
Mm-hmm.
And of course, we know that if they are being inspired to do that kind of work as a student, they will likely continue it for the rest of their lives. So it's really a wonderful thing to watch.
The impact that our students are making in the community, I think, is wonderful. And it's because very often our students are caring people, and they discover that they can care for others even without having clinical skills.
Sure.
So how much more once they have other skills that they can bring to the
Add to it.
community. Right.
Mm-hmm.
You mentioned the free clinic. We're also looking at a trip to Haiti. Could you tell us a little bit about that?
Well, many of our students went to Haiti last year, soon after the earthquake. We had a group go, and I think it was such a successful program and an experience for those students that we are doing it again. I know Dr. Hawkins plans to go with the group in January, and I believe there's 12 students at last count.
I think so, out of this class.
Very
Going.
good.
So we have a very excited group of students that are getting ready for that, and we support that as a program. We make sure that they complete all their requirements for their clinical rotation in January, but we really support their efforts.
Very good. And so you're going to be going to Haiti.
I am. We
Yes.
actually have 2 groups going this year, 2 weeks in
That's right.
succession.
That's
Oh, I
right.
see.
And so the first week we have 40 people, and the second week we have 40 people. There's a total of 80 all together from all aspects of the community going now. Not just medical. There'll be a lot of input with the orphanage that they started working with last time they were there. So it's a medical outreach for the community, as well as learning education. So there's our service learning coming right back
yes.
in, and our community now is just, instead of being in this town, it's just expanded the borders to the world, and that's what mission work is, actually.
Very good. And we recently had our white coat ceremony for our brand new students this year, and we had a guest speaker, Dr. Roger Paholka, and he was talking about potential missions to Swaziland in
Right.
Africa, which would be quite exciting. And so really the program continues to expand as far as service learning and service to the community, and that community happens to be the world, which is really very exciting. Now there's incredible need for rotation sites and opportunities for service learning. What do you see your role as being the community liaison?
I'm hoping to get stronger and stronger into the community as we develop more preceptorship sites.
Yes.
And as we have more and more of the service learning sites, our students and our community are beginning to know one another. Since this is such a young program, we are very new to the community. PAs are actually in their own right new to the community. Yes. It hasn't been that many, not an exorbitant number of decades, that the PAs have been practicing autonomously. So it is a wonderful thing for the community to now learn about PAs, to learn about our PA program and how we intermingle with the community, looking at the service, knowledge, faith basis that we have. And so I hope that Ms. Bochelle does an excellent job of contacting the preceptors and visiting the different sites, but we need to expand our community just a little bit more, and there's so much room to do that. I mean, we've just dusted the surface, don't you think?
We really have.
We've just dusted the surface, so there's so many other places to touch base with.
Very good. How many sites do we have now?
We probably have right now over 200 active sites, and most of those would be in the Charlotte, Monroe, Wingate, Concord area, though we are finding ourselves of late moving westward towards the mountains. We've had several students in the Asheville area, Hickory. We're moving towards the Hendersonville area, so we see some opportunity moving westward that I'm very excited about. Developing clinical rotation sites is always a challenge. I think I'm learning that, and in talking with other folks at other PA programs, it's always a challenge, but some of our best ambassadors are our students.
Yes.
And I am continually amazed at physicians and physician assistants and nurse practitioners who come across our students just in working with them at the hospital or practice sites, and they're impressed and they say, I'd like to do that, I'd like to have a student. And so it's really through those student contacts that we make some of our best inroads into the medical community. So I'm grateful for that we have such good students that make that kind of impression.
Mm-hmm.
Now for our students, obviously many of them would rather have their rotations right here in the Charlotte, Union County area. How far can we expand with rotation sites?
Well, of course, most people like to stay close to home.
Sure.
Though I will tell you that we have a student right now that has a special health services scholarship, and she plans on some rotations in the Midwest.
Very
with
good.
Some underserved areas. So we like to work with our students. That's what I tell our students, that I will work with them if they have a special request or a special need that will take them outside of the area. It's certainly something to look into. We do have some requirements by our standards to visit clinical sites and to have some control over where our students go and to know that it's a suitable site. But now with technology, we can make some of those visits virtually. And so I'm seeing that as we grow as a program, we will need to expand beyond this region and go out a little further. And I think it's going to be quite doable and also quite exciting.
Very good. You mentioned that we have to do clinical sites, site visits, both to see the site where our student is learning, but also to talk with our student and the preceptor. And I believe, Kay, you've been involved in some of those.
It is so rewarding. It is just
the
like
fun
you said,
part.
it is so much fun. Could you not just do that all day long? All day long, just go and hear all the wonderful. Our students are incredible ambassadors. You're right. That is a good way to put it. They are incredible ambassadors. And our preceptors are incredible personalities too. We've just been so blessed with a group of people who have been involved in helping these students become the best PAs they can be. And that's what it's all about. It's just having a little piece of helping someone to develop. And I just think it's outstanding that the number, the amount of diversity that we have in the preceptor sites. There are rural areas, and in a rural area, you're going to, by nature, do a good bit more than you would in a private practice in a non-rural area. There are sites in tertiary care hospitals where they're seeing the most advanced technologies in cardiology or whatever area that they're in.
Yes.
So the diversity is fabulous. And as they become more and more a part of each of these, it's fun for me to go around. I'm not a cardiologist. I love to go see the technologies going on, and just to be able to be involved with seeing the magic of medicine and how our students are involved in that, and how the preceptors are helping them step up to those roles.
Very good.
It is fun.
Yes.
You make site visits all day.
I'm actually visiting 3 students tomorrow, and I'm excited about it. I'm going to the Concord area and visiting a primary care practice, a surgical practice, and an internal medicine practice.
That's amazing.
And
Yes.
all new students on their first rotation, and it is quite rewarding to go. And the students are quite proud that they have reached this part of their training, and just to see their confidence build, it's an exciting time.
Very good. Dr. Roy Blank is our medical director, and he often has students in his practice. He said something rather interesting. He said there was one time when he didn't have a student with him, and the patient came into the room and looked around and said, "Where's your student?" She was looking forward to talking with the student. And so I think our students really, they take something with them into the clinical offices and practices in which they find themselves. A new dynamic, a new energy.
Without a doubt.
Yep.
Without a doubt. Those new eyes.
Exactly, exactly. What are some of the challenges that we have ahead of us as we expand? Eventually we want to have more than 20 students per class. What are some of the challenges that you see in our doing this?
Well, we certainly have a wonderful new facility.
What a blessing.
That is going to be an incredible blessing to be able to enlarge the facilities, the physical facilities. There's some classes like patient assessment where you must have small groups working together, and there's a bit of movement around as the students learn how to examine a patient.
Yes.
They need the facilities to do that. So I think that will, the physical facilities, I think that will help tremendously there. The outside lying sites, our students will hopefully open up new doors as they serve for ambassadors, and the physicians talk with one another, and the hospital areas talk with one another. And we had the student, and they were so great, and they said, well, maybe I'll get on board with that.
Yes.
We just have to be not so new. We have to get our name out a little bit more, and I think we'll be fine with getting the sites together.
Very good. So really letting people know that we're here,
Absolutely.
and seeing our students will help open doors. What is your perspective, Rebecca?
Well, I'm truly excited about the new facility also. I think that's going to be, we're going to enjoy being with the pharmacy school there in the new Levine College, but I think it will be a wonderful experience for our first year students. The second year, the clinical year, that's where we will have to do some more work, because as we get more students, we need to make sure that we have quality clinical rotation experiences for them. But I certainly think that being in this metropolitan area of Charlotte, that we do have a lot of new opportunity. We just need to get out there and develop it. And I think we are. I'm excited about it.
Very good. And
our first class graduates in December. So we must remember that we've got 18 people soon to be employed in the area, and those are more ambassadors for us.
That's true.
And potential preceptors.
In fact, one of our students you were mentioning earlier, he wants to know when he can be a preceptor.
Yes, he's already looking forward to it. Now we do like people to get a little seasoned, but he will be an excellent one when he is ready.
When he's ready, yes.
He will be an excellent one.
And I believe you're in the process of creating a newsletter of some sort.
Yes, yes. My goal is to have a newsletter at least quarterly that will go out to our preceptors. I think we need to let our preceptors know what other preceptors are doing too, so they so they feel like they're part of our faculty, and to create a more collegial atmosphere. So I have plans to, I've already got his approval. One of our surgeon preceptors and one of the students that worked with him will be our first feature in the newsletter. That should be coming out later this fall.
And this year in service learning, when the students do their presentations, the faculty and staff from each of the sites will come to see those presentations, and I think that will be very special too.
That'll be very good. And what have you enjoyed most about your coming on faculty full-time?
Oh, the people. The people. I think that medicine is just magical. I do. And I love being a part of teaching and continuing that on to the next generation of people to come along. And you do have a wonderful staff. I mean, just a fabulous staff, all of you.
And
it's good to be a part.
And you've been quite involved in teaching new courses and being involved from that perspective?
Yes.
Very good. And now we have a new platform, Moodle, but I gather you've had experience with that, and that's also being used by our students in clinical rotations.
Yes. Moodle is an online learning platform that many schools use, many universities use this same platform, but we're employing it for each of our clinical rotations, where students who are on the same rotation, let's say a general surgery rotation, if they want to share their experiences, a good resource that they found on the internet or elsewhere, they can share those experiences in a safe place on our Moodle site, and they can learn from each other, ask questions of each other, and I think it's going to be a great tool. Our students these days are used to networking,
sure.
And we want to give them a safe place to network.
Very good.
And so each clinical rotation site has their own online site.
Well, thank you. And thank you both very much. We've been talking with Kay Hawkins and Rebecca Boschel, both our new faculty members at Wingate's Physician Assistant Program. This has been Partners in Healthcare. Thank you for joining us.